Hello, Franklin. Tonight I invited Dr. Let's see if I can get it right the first time. Harangozo.
Harangozo, yes.
Harangozo. And to talk about questions people might have if they're infected or if they know someone's infected, et cetera, et cetera. Why don't you tell everyone your credentials?
Well, I'm a pulmonary critical care physician and work out of Robert Wood as well as St. Peter's. I'm volunteer faculty at Robert Wood Johnson Medical School and got a volunteer faculty award a couple of years ago. So try to speak on in English to my patients and the people around me.
And you've been taking care of COVID patients, correct?
Yes, I have been taking care of COVID patients both in the intensive care unit as well as in Robert Wood as a pulmonary physician, and also in St. Peter's rounding with the teams as a pulmonologist as well.
Excellent, excellent. So I'm a neurologist, and in neurology, we refer to people like you as real doctors. So, all right. So I just wanted to read a little disclaimer I wrote. This is general information. You need to consult your personal physician for medical advice. This is general advice, and the specifics of your case may alter the appropriate actions. I'm going to harp on that later on in the recording. So I'm going to kind of be the patient, and I'm going to ask you questions, and let's see where that brings us. So I came up with a few.
Okay.
So I feel fine, but I got tested just to be a good citizen, and it came back positive. What do I do? Do I come to the hospital? Do I go to my doctor's office? What do I do?
Do not go to the hospital. Do not go to the doctor's office. Just make sure you isolate yourself and stay quarantined for 10 to 14 days. Follow your temperature. Pay attention to whether you're more short of breath or not. If you are positive, you should tell your doctor for sure. They may want to do a telemedicine visit with you, but you should not be exposing other people to the fact that you do have the virus.
So when you say quarantine, does that mean I can go for walks and go to the curbside pickup? Or what does quarantine mean?
Quarantine means do not come in contact with anybody that you can avoid coming in contact with. If you are in the same house as someone else, you should have the individuals that you can isolate from in a different part of the hospital, in a different part of the house. You should not be using the same towels. You should not be using the same food. You should make sure that you are taking care of your things that may have been touched by you, and other people take care of themselves.
Okay, great. So let's move on to another patient question. I have a fever and I haven't been tested. What do I do?
The question is, what other symptoms do you have? So most patients with COVID do have symptoms of loss of smell, loss of taste. The problem is we're going into flu season, and many of the symptoms that you have with the flu are the same symptoms that you can have with COVID. And so you need to be aware of that. If you are presenting with significant symptoms, you should be calling your physician. And there are certain places where you can get PCR tested. That's the nasal swab, or some places do saliva. Most of the places are nasal swabs to check PCR positivity, which is one of the things that the virus has within it. It's the RNA that's being tested and multiplied to be able to see if it's present in your nasal passage.
So I don't run to my doctor with a fever?
You call your doctor and say, I have a fever, I have these symptoms, what would you like me to do?
So basically the theme I'm getting, if you suspect you have COVID, don't run into your doctor's office, call them first.
Yes.
and let them figure out the best way to handle you.
Yes.
Great. Um, so my sister or my husband, who I live with in my house, is sick, but not tested.
Why? Well, again, they should be reaching out to their physicians and they should be possibly tested. The issue is it's unclear how much testing capability we do have available. If we have enough testing capability available, then everyone can get tested multiple times. And such tests are being done in places where we have individuals that are working in contact with the public, where they are being tested on a routine basis. Usually what's being done is temperatures are being checked. And if someone has a temperature, that's the first step towards checking to see if they have any of the other symptoms. And then you go from there.
Okay, so if they do have some symptoms but haven't been tested, should they stay away from family?
They should until they know they're negative.
Okay. All right. So moving on, we kind of covered this already. My sister slash husband who lives in my house tested positive. That's kind of the same thing as we discussed if you test positive.
The issue is whether or not you are symptomatic or asymptomatic. If you are asymptomatic, you can get tested. And if you're tested negative ×2, chances are you do not have the virus. On the other hand, you should be being quarantined from people around you for 10 days.
So I just picked up on something there. If I have a fever and I get tested and it's negative, you're suggesting that's not 100% sure that I'm negative?
It's not 100% sure. Again, the loss of smell, the loss of taste also engages and makes it higher likelihood that you have a COVID infection.
Okay, and then I'm going to go through the disclaimer again. You need to consult your personal physician for medical advice. This is general advice, and the specifics of your case may alter the appropriate actions. Okay, so my son is at college and his roommate tested positive. What advice would you give?
Chances are he's been exposed pretty significantly and he should isolate himself and also go get checked for COVID as well. COVID testing, nasopharyngeal, PCR testing.
So should he run home?
No, because then he's going to infect mom, dad, and grandma, as well as the little newborn at home. So he should isolate in place. Some colleges have set up scenarios where they have the students still at college, but in a different place while they isolate to make sure they're not being exposed to other people and they are not exposing other individuals either.
Okay. So new patient here. I tested positive. I was sick, but now I feel okay. What do I do?
How long were you sick? What period of time was it? Basically, you can continue to have virus particles being deposited or coming out of your nose, your mouth, but not necessarily infective. So if you go and get tested with a PCR, you still may come up positive. The issue is that 21 days is essentially where they think that you should no longer be infective to the individuals once you are no longer symptomatic. That's not as far as working or not working, it's as far as you're saying that you are negative, you are no longer symptomatic. The thing is, everyone is still supposed to be wearing a mask, gloves, and I would assume that that individual is no longer COVID positive at that point.
So I'm a little confused. So I'm like, I was sick, I tested positive, I'm feeling good. Let's say it's 10 days since I tested positive, but I feel good. Do I have to wait more? Do I?
When was the last time when did you start feeling good? How many days ago?
Okay, let's say yesterday.
Because it really should be a number of days after you started to feel good that you're isolated, still not going back into work.
Do you have a specific on the number of days?
I'm sorry, I'm not 100%, Phil.
Okay, so you deal with people in the hospital, not dealing with people at home quite as much. Okay. Um,
I'm dealing with doctors who need to get back into work. And so we have the 10-day rule, but that's not necessarily 100%
10 days from when?
from last illness.
Okay, so should wait at least 10 days from the time you started feeling well.
Right.
Okay. Um, Someone at work tested positive. We both wear masks. I work with him on and off during the day. What do I do?
You should be continuing to follow your temperature. In theory, you should be safe, but you have to be alert to any symptoms that you may have. You should be okay.
Okay.
But
And
if any symptoms, you would check COVID status.
okay. And now this is the third one I have. I'm healthy. I feel fine, but I want to be prepared. I'm a Boy Scout. What could I buy now, just in case myself or someone in my family gets uh, sick or gets worried that we're sick, or et cetera? What could I have at home that would be helpful?
Chicken soup. You should, you just should be wearing a mask and using hand sanitizer. That's the bottom line. That's the safest way to keep yourself and your family healthy.
So I've heard though that, my doctor may tell me if I do become positive, that they might ask me to take aspirin. So should I have aspirin at home?
As a baby aspirin daily when you're into a course of infection where you are symptomatic. You can start taking a baby aspirin because there is increased risk of getting blood clots when you have a COVID infection. It's not going to prevent you from having a COVID infection. And we're not talking about taking a handful of aspirin. We're talking about a baby aspirin because the capillaries get clogged and clotted because the COVID causes increased tendency for in situ, which is little capillaries getting clots. And so the baby aspirin is to prevent those clots from occurring.
Okay. But so you're not taking it to prevent it, but basically you're saying wait until have it at home. You can have it at home, but wait till your doctor tells you that you should take it.
Exactly.
Okay. And then I personally bought a pulse oximeter in
So
case
did
I,
I.
okay. And I actually took it into the hospital yesterday and stuck it on one finger and a hospital grade pulse ox on the other. And, I saw that it was dead on accurate. Um, that last step is probably not available to everyone, but do you think it's a good idea for people to buy a pulse ox?
If you have a tendency towards chronic illness, you have chronic obstructive pulmonary disease, heart failure, lung problems, asthma, diabetes. It may be helpful for guiding you whether or not you need to go to the hospital. Shortness of breath, some people are more in tune with their bodies than other individuals. So what the pulse oximeter does is it tells you the estimate of what your oxygen saturation in your body is. It should always be above 90%. Most of the time in healthy people, it's in the high 90s. No, you don't need to be 100%. And what happens is if you start to have disease in the lungs from COVID, your oxygen saturation will start to go down. And with that, the pulse oximeter may give you a warning that instead of running around 97%, you're running 93%, and you may not notice that. And so that would give you guidance to tell your doctor, I am finding that my oxygen saturation is going down. You should always be above 90%. And so 90 is the cutoff usually for where you need to be in the hospital.
Okay. Any other things we should discuss you think would be good for the general public to know?
If you have to go to the hospital, usually the drugs that are being used now are remdesivir, which is an antiviral drug. It's given to patients for 5 days total and needs to be started within a 10-day period of time. The other thing that they're doing is giving steroids, which is Decadron, 6 milligrams daily for 10 days to reduce the inflammatory response that the body produces. Those are the two things that we now know are definitely helpful as far as the steroids are concerned. The remdesivir may shorten the amount of time you are ill. The other thing that we are doing is having people lie on their stomachs instead of their backs, because it helps open up the lungs so that you get better oxygenation and a better oxygen level in your bloodstream. Those are the major things before we get more aggressive in your care, including giving you oxygen and giving you full dose anticoagulation, which is blood thinners, and having you end up in the intensive care unit if you need to be.
Okay, great. Well, we thank you very much, doctor, for your time. I'll read the disclaimer one more time. You need to consult your personal physician for medical advice. This is general advice, and the specifics of your case may alter the appropriate actions. We really appreciate you being here. You're a good citizen, and you are a hero doing the things you do.
And Dr. Kramer, you are also, so thank you for everything you do as well.
Hardly that, but okay. All right, I will sign off with my usual sign off that I do at the end of my council meetings. Be well, Franklin.
Be well.
We're off. I think we're off. No, it's supposed to. Oh, oh boy! I hope we were recording.